My name is John Maskey. I'm founder, CEO of Triage Staffing. We're based here in Omaha, Nebraska. We've been at this for 15 plus years, having tons of fun. We're a nationwide healthcare staffing firm. We place traveling professionals all over the country. We work in all 50 states. We place nurses, rehab therapy professionals, cardiopulmonary professionals, radiology professionals, and medical lab professionals. They do 13-week contracts, and when they're done with those assignments, we get them amped up for their next triage contract and get them on the road again. When we've done research and talked to travelers and asked them directly what it is that they are seeking, overwhelming response is, we don't want there to be surprises. We want to be taken care of. And as part of being taken care of, we just want to be shot straight. What directly sets Triage apart in our industry is that we're real. Big reason why travelers choose Triage. We are not spinning some fantasy of what folks are going to expect on contracts just to put a square peg into a round hole. That's not who we are. We're candid, we're upfront, we're honest, we're straight shooters when it comes to sharing information about the assignments that they're going to take. We might do more to talk someone out of a contract than we do to talk them into a contract. That's what the Triage difference is. That's what we're about. As we looked at the entire market, we realized that technology was going to have to play a big role in. And we're not a tech company. We're not pretending to be a tech company, okay? We're a staffing firm. We get relationships. We saw an opportunity with a company called Kamana Health that is a technology company that had a simple solution for how they could make travelers' lives better, easier, simpler.
I love nurses. I love my fellow nurses. I've gotten to work from Florida all the way up to Alaska with, different RNs, CNAs, rad techs, occupational therapists, and this kind of common denominator of like the paperwork associated with our careers. I mean, it just sucks. It's a big time suck. It's frustrating.
Healthcare professionals were used to like texting their licenses, texting their certifications, which isn't that big of a deal. But then when you get to things like history and physicals and vaccine records and all these social security cards and driver's licenses and sending stuff via email and text and walking down to the 4th floor of the hospital or the basement to talk with HR. And
like it's a paper folder and I've got documents that are immunizations and health records and TB mass fits. And then I've got photos on my phone, I think somewhere of certifications and licenses, etc. And I've got a dusty old laptop that I have to travel around with because you can't do this stuff from your phone. In the travel healthcare space, it's very speed to market. This remote data exchange must happen quickly if you're going to be successful as a travel nurse. Well, no, I'm talking to other travel nurses and they have the same problem. And then I'm talking to that physical therapist and that rad tech that's not even a traveler and they're having the same problem.
My initial reaction was, Trey, there's got to be a better way to do this stuff.
There's got to be a better solution for this.
I was shocked by the fact that no one else considered the pain points of our healthcare professionals important enough to make the investment or really figure out the problem and the solution to go with it. Kamana spent so much more time on that than anybody we've seen in the space. We knew that if we didn't do something about the problems our clients and our travelers and our healthcare professionals are facing, somebody else would. We wanted to be the first. Kamana was the answer to do that.
And Kamana provides that healthcare professional a digital wallet, and that essentially is just a unique place to store, track, manage, and share all their stuff.
When we think about the problems that we're looking at in credentialing in healthcare, again, it's not local to just RNs or travel healthcare professionals. It's a big problem. It's systemic. It's across healthcare professionals. It's with travel agencies. It's in hospitals, clinics.
One of the things that drove us to start Kamana was Trey's personal breach of his information.
I get this letter in the mail one day saying that my data's been breached. I emailed this sensitive information, medical records, social security card, tax home address to a recruiter. They get their stuff hacked and my data's out there. And I want to be mad at the hackers. I want to be mad at the situation, but I know better, right? I would never do that with a patient's data. I would never email somebody else's sensitive information. I'd lose my license. So why am I doing that with my own personal stuff?
At the center of our platform, we have always focused on security. We have made sure that anyone who needs access to this platform can get it securely and that the traveler can share those links with whoever they need to without having fear of compromising their information. We do this by making sure that we're at the highest standards of encryption on our platform, and we do that without actually making it harder for our clients and our travelers to share information.
In our mind, it's just about how we can solve problems with technology and keep things simple.
What we're really driving towards at a rapid pace is getting healthcare professionals all over the country on this platform to ultimately be able to say, hey, I want to work here. Here's everything you need to know about me. And instead of starting from scratch, they're already 60, 70, 80% of the way through the process. And our goal as a company is to bring that process from many weeks to just a couple of days, or maybe even less.
When I think about what it means to be partnering with Kamana, we've got somebody who has a mentality that the traveler is first, that the healthcare facility is first. Giving a traveler the ability to take their career into their own hands, and also by connecting our clients a lot faster with those healthcare professionals.
When I think about Triage, there's the connections, there's the resources, but I think most importantly, they're passionate. They're like, let's go after it, let's get it, like let's do this. And healthcare credentialing, not the most sexy industry, right? They want to disrupt this market. They want to provide solutions that are global, that are not specific to their organization, which was really important to us.
They've got this vision of how can we serve the travel healthcare market and then take that and replicate it for hospitals and for nursing homes and for medical students and for folks coming out of universities that are looking for their first job.
The bigger picture here is making sure that we create efficiency and a great experience. People talk about disrupting industries and things like that. We are willing to disrupt even our own model. As we apply that philosophy to the platform that we're building, we know we're going to get it right.